Hello, everyone, and thank you for joining us on this segment of Christian Access. Today, we have a special treat for you. We're joined today by Dr. Golastani. How are you, Dr. Golastani?
Hi.
Okay. Let's go ahead and get started. Tell us a little bit about yourself, Dr. Golastani.
Sure, and thank you for the opportunity for this wonderful interview. So I am a nephrologist, which means a kidney specialist, but I also do a lot of primary care and high blood pressure. A portion of my work involves taking care of the dialysis patient population. And I'm quite dedicated to my work. I've been in practice since 2004, and it has been in the Bronx in affiliation with Montifiore Medical Center. I did my training here as well, so I've been in the Bronx since 1999 and can't seem to leave it.
Wow, that's a very long time.
Yes, it is. I did have another job for about 6 weeks, but this is honest, I really miss the population in the Bronx, so I came right back after 6 weeks.
Okay.
Originally I'm an immigrant. I was born in Iran, and I came here when I was 13, and went through the public school system, college, and then went to medical school in Westchester, New York Medical College. And back then I wasn't really sure what I wanted to do as a doctor, but it became clear to me when I was doing my residency training at Montifiore, that there was something about kidney disease and the cognitive challenges that kidney disease presents that I found very intriguing. It's one of those specialties that you will never really master. It's just very intellectually difficult science to master. And I started to take care of patients, and I really kind of fell in love with the discipline and really liked the relationship building that ensued after meeting some of my patients as a trainee, as a fellow. Finished fellowship in 2004 and joined the academic faculty at Einstein Montifiore Medical Center. So we take care of about, just to give you an idea, 500 dialysis patients about across the Bronx, over maybe 10 dialysis units.
Wow.
And that's not to include our chronic kidney disease population, which is more like 5,000, close to 10,000 patients. And like I said, we also take care of patients in the hospital, in the intensive care units, and act as internists when it comes to blood pressure control and other aspects of internal medicine as well. Our patients here, the patient population in the Bronx is extremely rich in terms of the kind of diseases that are presented to us. I think that probably has a lot to do with how international the Bronx really is. And as a person training and practicing in the Bronx, it's an extremely rich experience to work here. Not to mention that the work that you do here is quite impactful for a lot of patients, and that there's nothing more as a doctor that is satisfying than to feel like you made an impact on someone's life. So very happy to be a practicing nephrologist right now with my current academic title and responsibilities. So in a nutshell, I hope I answered a little bit of your question regarding.
Yes, absolutely. Now, let me ask you a question as far as patients are concerned. What are some of the issues you face with helping patients? As far as like their responsibility. Of course, the doctors can help us as best as they can, but there's also patient responsibility.
Yes, there is. I'm glad you asked that question. I think a lot of times there's a big divide between what we think as doctors we're delivering to the patient and what the patient's actually getting. So I can't stress enough how much power lies in the patient and his or her ability to not just follow some of the advice given to them, but to just make some common sense decisions regarding lifestyle and regarding, activity and diet. There have been multiple studies showing, and this is going to come as a surprise, I think, that if a patient takes it upon him or herself to do the right thing consistently, by the right thing I mean to, do a little bit of exercise consistently during the week, and to eat smaller portions and less fatty foods that are maybe not as convenient. Studies have shown that those choices have a much huger impact than any medication ever made, for example, for diabetes control, for blood pressure control, for chronic kidney disease, which usually happens because of hypertension and diabetes. Good decision making is very impactful. Now, as far as some of the barriers that I see, I think that on some level, as healthcare professionals, we need to be aware that what we think we're delivering to patients is not being delivered. And that, I think, is a national issue that's being brought up more and more with accountable care. We are used to our lingo, we're used to our trade names, and we frequently kind of trail off with names of 10 to 20 medications that patients cannot keep track of. And we don't spend the time to really describe the uses and the importance of regular medication intake, nor do we take the time to describe potential side effects that a patient may have that would require that patient then to pick up the phone and call us. So on our end, I believe we're not being aggressive enough in engaging our patients. And there are reasons for this. It's easier not to engage your patient, honestly, in that sense, because when you have 15 minutes to see a patient, you'd rather have it be seamless. You don't want a lot of questions. You don't want to spend the time to describe. The healthcare system is built in a way where you're really not rewarded for spending a lot of time with your patients, which is quite unfortunate and hopefully changing. But I want to also mention that as a patient, I believe it's very important to engage your doctors. You have few and far between opportunities to do so. Most of us doctors want to be engaged with you. Most of our doctors feel a great sense of responsibility, and we would respect any attempt at trying to understand on your part things that you are unable to understand or things that are going over your head. You need to tell us, because we don't know how much you know or you don't know.
Right.
I think as a patient, it is very important for you to do your job, and that is to take ownership of your healthcare issues, to take ownership of what you don't and do understand about your healthcare issues. You can go, there's various resources, read up on them, and then ask if you don't understand. Ask us, ask the resources. There are many ways to do this. You just have to do it. And it's extremely, at times, frustrating when we don't know as doctors how to engage you and you don't help us. And so what's left is, unfortunately, is a void of communication, and who ends up losing in the end is really you, the patient, which is, I can get frustrated and upset, but ultimately it's not affecting my health. So again, to summarize, I would encourage asking questions. Be a pain if you have to. Make your doctor a few minutes late. That is your opportunity to take advantage of your time with your doctor. Ask questions. If you don't understand something that they're doing, challenge them. We respect that. We want that.
I have another question I'd like to ask you, also in regards to that. Um, what are some of the preventive steps a person can take to avoid end-stage renal disease?
Well, so let's talk about kidney disease in general. Kidney disease is something that a patient probably does not feel at all. It refers to a gradual loss of kidney function. Now, the kidneys, most people don't know what they do or where they are. The kidneys are usually in the back on either side behind the rib cage, and they are involved in kind of maintaining the body, cleaning the blood of waste products, and getting rid of the extra fluid that we accumulate as organisms. A little bit of kidney loss is probably not going to have any symptom for the patient. So a lot of patients actually go for years with kidney disease, so much progress that there's kind of unfortunately no turning back in a sense, and it really becomes a matter of stabilizing the kidney function so that they don't go on to dialysis. Now, about 26 million adults in America have chronic kidney disease, and I think it really should be more on everybody's radar as a possible health outcome, much like high blood pressure and diabetes is. The number 1 and 2 etiologies or reasons for kidney disease in America are diabetes and high blood pressure.
Okay.
Now, I wish I could say that there was a way of curing kidney disease in people who get it. There is no magic pill. There is nothing that can be given that will reverse kidney disease, especially if it's of the kind I mentioned, which is the chronic kidney disease kind, a result of diabetes and high blood pressure. I can tell you, however, that should the right decisions be made early on regarding sugar control, blood pressure control, weight management, and regular intake of medication that keep the heart and vascular system healthy, the kidneys really do stabilize at the function that usually the doctors find them at. If you have stable kidney function that's not perfect, you'll probably do okay. However, if the kidney function is not stabilized and progresses aggressively or rapidly, then you're really talking about really the only option left, which is preparing for dialysis. Dialysis is renal replacement therapy. In other words, when the kidneys fail, the body really needs a mechanism by which to get rid of its waste products and extra fluids where the kidneys can't anymore. And dialysis is a machine that does that, however imperfectly, unfortunately. But it is a way to do the function of the kidneys at about 10% of what the native kidneys would do. So in terms of what to do to prevent kidney disease or progression of kidney disease, I would say, well, obviously, see your doctor regularly. Most Americans don't realize that they have a 59% risk of developing some form of kidney disease during their lifetime. Risk factors include being of Latino or African American race, being over the age of 60. As you age, your kidneys do start failing slowly. And most people don't realize that when they go to see their primary care doctors, often they have bloods drawn and urine taken. Well, those tests are meant to screen for kidney disease. So following along from the last question, I would comment that it would be imperative that you ask your doctors about those routine tests that they do on you when you go to see them. Ask them about the urine, ask them about the blood tests, bring it up to them and have them tell you if they're normal or if abnormal, how they're abnormal and why, and whether you need a referral to a kidney specialist. On a more general level, I would say eat healthy, get engaged with your health, take your medications regularly, exercise as a way of maintaining your weight and your health, and good things will come out of that. If you are of the class where you have unremitting diabetes or another disease that's very difficult to control, then you need to see the proper specialists in an associated medical center. I am gonna just mention that the National Kidney Foundation has a website that is extremely useful for patients to go to and read about various ways they can either control or diagnose their kidney disease. So I really encourage you to do that and to just ask questions all the time.
Now, question number 4, and this is going to be our final question. What can patients do to be positive during their time while on dialysis, while waiting for transplantation?
Well, so your question is actually very well timed. There are programs that are sprouting up across the country.
Okay.
Actually, mostly sparked by an interest from the federal government, who provides Medicare. Medicare is the insurance program for elderly adults, but I don't know if you know this, but end-stage renal disease patients who have kidney disease to the point where they need dialysis automatically qualify for Medicare. And this was a ruling back in the 70s. It's actually the only program out there that guarantees insurance for a specific disease entity. So most of your dialysis patients are on some form of Medicare unless they're actively working. So Medicare obviously is interested in improving upon not just the health and satisfaction of patients, but also the outcomes of their patients, because they're footing the bill. And so they've put out proposals for ways in which to improve not just quality of life of patients, but also compliance with prescribed therapies and the dialysis treatment itself. So Montifiore is one of those centers in the Bronx where we are actively looking to develop a program through our care management organization. Now, I'm actually involved in developing that program. There is various ways for a dialysis patient to, number one, accept the diagnosis of end-stage renal disease and having to be on dialysis. Remember, that's a hard transition. End-stage renal disease patients can attest. When you go from not being on dialysis to being on dialysis regularly, it's really a lifestyle adjustment. And I think that's something that patients find very hard to adjust to. There's also out there in the lay press and some urban myths maybe that make dialysis seem as if it's, this death trap, or if you're on dialysis you might as well be dead. But I'm here to tell you that that's absolutely false, and I don't know where those rumors got started. Dialysis is really a way of maintaining someone's health as a bridge to them getting a transplant. Now, kidney transplants are difficult to obtain because of the shortage of organs in this country, and so we like to think that dialysis is a means of keeping them alive until their turn comes up for the transplant. As far as how to adjust to dialysis and life on dialysis, I would say, I would ask the sponsoring dialysis unit social worker to hook you up with either a peer who's already on dialysis who can really counsel you and talk to you about how they overcame some of the challenges that they faced. There's also mental health services if things are looking really grave, where you're really having a hard time going on day to day, that can really help you with that adjustment. The number 1 and 2 things that I would say outside of the psychiatric issues that come up when adjusting to dialysis are you need to be compliant with your dialysis treatment. 3 times a week, 3.5 to 4 hours each time of dialysis fulfills about 9% of what your native kidneys would do, which would be 100%. So this is minimal support that you're being offered by Medicare and the dialysis units. So if you miss a treatment or if you cut a treatment short, you're really cheating yourself, because that 9% is going to go down to 6%, and you're going to feel it, even if it's not obvious or it doesn't come up right away. You're going to feel the effects of that over time, not to mention that it's probably not good for your longevity. So I would stress compliance, and if I were a superhero, I would get rid of any barrier to your compliance to the dialysis treatment I could, whether it be transportation, whether it be depression, whether it be need to work, whatever the case may be. There are ways to get rid of those barriers. The number 2 factor that I would like to bring up is what you do at home regarding eating and drinking extra fluid. Unfortunately, with patients, when they eventually lose kidney function and that necessitates dialysis initiation, they only have 3 opportunities during the week to get rid of the extra fluid that they've accumulated, unlike someone with kidneys who is able to get rid of fluid constantly as they urinate. So with dialysis, it's really imperative and important to make sure that you don't drink too much, because if you do, before your dialysis treatment, that fluid's going to go into your lungs and into your heart, and it's going to make you very, very sick. So number 1 and 2 are compliance with your dialysis treatment. Number 2, make sure that you follow the dietary guidelines with fluid intake and the types of foods you should eat as much as you can. Number 3 goes back to the second question. You have a staff of professionals available to you at the dialysis unit, or even if you're doing home dialysis techniques, there are professionals that have been put there to basically answer all your questions and to make sure all your needs are met. Please take advantage of them. This goes back to patients who go to doctors and nod and don't really understand what's going on. Same with dialysis. Please engage. Please read, please ask questions, please involve the staff. That's their job. Ask them what you need to do to be a healthier patient, what you need to do to feel better. Ask them for help if you're having trouble. They have the resources to help you, but it's up to you to ask, really. And unfortunately, I wish I could say that as a nephrologist who rounds on dialysis patients all the time, and as the staff here at various dialysis units, I wish we could say that we know what your needs are. To some extent we do, but we don't know all of them, and that's where you come in as a communicator. So that's my few cents about...
Now, give us what the signs and symptoms are, and then after that, give us your final statement.
Okay. So... like I said, early on in the course of chronic kidney disease, there are really no very overt symptoms that you may feel. Late in the course of kidney disease, and I can't tell you how many times this happens in patients who see doctors regularly, where they kind of come to my office much, much too late, such that they have kidney disease that we call stage 5, which is kidney disease that's below 15% function out of 100, 15 out of 100. So just to backtrack a little, there are 5 stages to chronic kidney disease, and stage 4 and 5 are the most advanced and most serious, and the ones that you should really try and learn about if in fact you have them, to challenge the doctors and try and learn more about. Now, having said that, if you have stage 5 kidney disease, you will start to feel some symptoms. They include feelings of lack of appetite, severe fatigue, difficulty sleeping, neuropathy, which is really either a jumpy feeling in your legs or chronic kind of pain in your legs that gets worse at night frequently. You can have itching all over your body. You can also have nausea, if advanced enough, you just have daily vomiting every morning. The classic description is some of my patients who've had it described, they go to brush their teeth in the morning and they gag and actually vomit instead. So those are classic signs of very advanced kidney disease, and you should pay attention to them. The not so advanced kidney diseases, namely stage 2 and 3, stage 1 is really a urinary abnormality that you don't need to know about. Stage 2 and 3 kidney disease is probably not symptomatic, but the signs are there. So the signs may include a blood pressure that's become a little bit more difficult to control, perhaps swelling in the legs or extra fluid in the body. If you track your weight and you know that you haven't been eating more or you shouldn't be heavier than you've been, fluid certainly after it accumulates can increase your weight as well. Other signs include blood tests, like I mentioned before. When they do blood tests, one of the elemental things they check is called the chemistry. And the chemistry includes two values, the BUN or urea and the creatinine. Those two values are markers of kidney disease. If those two values, BUN and creatinine, go up, it's a sign that you have kidney disease. And how far up they go will determine what stage of kidney disease you have. So ask your doctor, what was my last creatinine? What was my last BUN? What was my last set of kidney markers? The other sign is in the urine. If it happens to be protein in the urine, which they check for whenever they collect your urine, or blood in the urine, which is something else that they check for when they collect your urine, those are also signs that there may be a kidney problem. And you should ask your doctor about your last urine test, especially the protein part, whether it had protein or not. So in closing, I hope I was able to maybe inform your audience a little bit about some of the risk factors for kidney disease, and hopefully to empower them a little bit. And if that's the only thing I did through this interview, I'll be happy leaving here. That is to have empowered your audience to go in there and ask those questions. And when you don't understand, say, I don't understand. Like I said, I think for the most part your doctors would actually respect you more if you did that. And it would make us feel like we're having more of an impact when the discussion has two parties going back and forth, as opposed to me just, or the doctor just blurting out a series of instructions, not really knowing whether it was registered or not. So that's my closing remark, I really would love if the community could get more engaged and to guide people like me on how to help them better.
Okay. So thank you so much for your time and your patience. Thank you. It was greatly appreciated.
Thank you, Mr. Butcher. Thanks for the opportunity.